Not bad.
Somebody told me, or I wouldn't have bought it either.
Oh my God, this is not right. Okay, so what do you want to do? I don't. Oh, the 27th of October. So instead of being on the 20th, no, Wednesday. No, the third Thursday is the third Thursday, right?
It's gonna be on the 27th.
No, the primary was so early.
She's actually been the chair. Yeah.
Check it out, I'm sure, I was told that. Here.
Well, I better mark that down.
Why did you do this?
I can't get the energy.
Seven, six. Close that. This code. Nine.
Yes.
Steve, I'm from the National Department. Oh, okay. Sitting in
I only got 2 more weeks. My eyes aren't able to see here.
That's just a nice picture.
I can be there, but actually. Well, the first time I'm going.
Oh,
sure. But Gavin told us I was here to see. I go with the baseball team from St. Margaret's, and I stay with the team. Then the second time I go, I'm going to Kissimmee. And then we have this resort. And it's called the Lazy River. And I'm all out, that one day I think I was out, I got burned.
Okay, yes, we're ready to go.
Oh, I loved it.
It is 3:01 and I'm gonna call this meeting to order. We only have Christine from the Menasha Health Department. She's the only one that doesn't have a name tag, so yay, that's great. The first thing we're gonna do is need a motion to approve the January 8th meeting minutes.
I second.
Well, I didn't even know we were ready. Go
Okay, and since we do, I don't know who Karina Jolin is. She's online. And we have Christine from the National Health Department, so I think it might be nice if we go around and introduce ourselves. My name is Kate Fentner, and I'm the chair of this committee. And I'm here because I had a husband with, he's since passed, but he had young onset dementia, an FTD, a daughter with persistent and pervasive mental health issues, and I had a brother that was developmentally disabled. So I check all the boxes.
A lot of experience, way more than you ever want to ask for, probably. I'm Jan Olson, sort of represent the Winnebago County area community, but also have some history with various relatives with Alzheimer's, dementia, whatever.
I'm Harold Singstock from the city of Oshkosh.
represent the elderly?
Rob Patterson, community member,
Beth Roberts, Director for the ADRC.
Michael Robinson, Winnebago County Board Supervisor, District 15.
James Ponser, is it Jim? Jim Ponser, county board member also, District 18.
Brian Nagler, our program supervisor at the ADRC.
Lori Duclan, Winnebago County Public Health nurse.
Sue Ertmer, I represent the elderly.
Jim Lauer, I am from Nina and represent one of my senior citizens. Senior citizens. And I invited Christine and she came, so great.
I'm Christine Hunter. I'm the Public Health Director for the City of Menasha Health Department. So thank you for having me.
Welcome.
I'm Brooke Slick, and I am just a direct support professional. So I work with.
You work there?
I work with people, so I'm just here for educational purposes.
I'm Elisa Ricchetti. I'm the Dementia Care Specialist with the Aging and Disability Resource Center here.
Liz?
Sorry, it wouldn't unmute. Hi, I'm Elizabeth Jones. I've been on the committee for a while. I am the mother of 2 young men with autism. One has a very mild form of it. One is significantly challenged by it. And I'm also very involved in the autism disability community.
Karina?
I'm Karina. I'm one of the ADRC specialists.
Okay, great. Well, thanks, everybody. Okay, so moving on, and I wasn't smart enough to print the agenda out. So, falls prevention, Beth and Brian.
So I'll start out. I'm not sure how aware you are, so I'm gonna assume that you don't know anything about our falls programming here in the county. We started working with the Oshkosh Fire Department to look at people who had repeated falls and the number of times that the fire department had to respond to those calls and how that was taking away time from other things that they needed to attend to. They set up a system where they now charge people if you've had more than 2 falls. And yeah, so the reason why is because we want people to engage in ways to prevent the falls. So our public health department offers classes such as Strong Bones, Walk with Ease. They have several evidence-based prevention classes to help with balance and strength. We at the ADRC have many, many different things that we can offer to people who might need assistance. And then we have Rebuilding Together, which I'll share a little bit more about later in the meeting, that helps install grab bars at no cost to the person. We have the Oshkosh Senior Center, who has got their programmings, including a biometrics machine that helps you kind of figure out where you're at with fall risk, as well as, again, programming. And who am I missing? Ascension at Home Care is part of the planning, but yeah, so we all get together, and where we're at today is that when someone falls, they get permission from the paramedic who has responded to make a referral. They contact 211, so that would be the United Way 211 program that you're all familiar with. 211 then reaches out to the individual who has fallen and tells them about all these different programs that I just shared with you. Like what you think might be helpful for you. And then they make a warm handoff is what we call it, meaning they'll make the call with the person. Like, if you'd like to talk to the ADRC, would you like me to get them on the line? And then they'll make that warm handoff. Or if they said, you know, I fell in the shower, it's getting harder for me to shower without, you know, slipping around. They would make the call to Rebuilding Together and make that referral. So they assist, or the same thing with the Senior Center or other services. So 211 does that, and then they also do a follow-up call with the individual. If the individual chooses not to engage and continues to fall, they do get the fine. If they choose to engage in any of those programs, then they do not get fined. So it's kind of like an incentive to get people to
try and look at some fall prevention. Wisconsin is the second leading state in death-related falls. So, you know, the statistics tell us we need to do something different. They did have a program at one point called Mugs for Rugs. And if you got rid of your throw rugs, because throw rugs are a huge risk, you got a coffee mug, and then there was probably 5 or 6 places in town that you could get it filled for free during the period of time. So again, trying to incentivize people to make some changes. Throw rugs are hard for people to get rid of. And then about a year ago, I guess maybe a little bit more-ish, we expanded it to other fire departments. So if you fall somewhere in the county and they're in the local fire department who covers your area, gets permission, then they make the referral to 211. So that's in essence the program. Brian, you want to take it from here?
I was just gonna say, when we started this program, it was basically the fire department, public health, and us as the ADRC. Corinna, who's actually joined us, was kind of our point person on staff here. But as this has grown and more partners have joined, it doesn't always make, what we were actually finding is a lot of people were referred to us from the fire department, and then we couldn't get a hold of them. It was like, kind of like they were saying that, yes, we will try it, you know, to get the fire department out of their apartment. And then when it was kind of a wild goose chase. We did make some, you know, effective communications and helped, but it wasn't what we would have liked. So kind of reassessing, like, do all of these calls need to come to us, or should they go directly to the senior center for the people who want to check their balance on that machine and stuff like that? So I feel like that's our purpose as an ADRC, is to stand in the gap when there's nothing else. And then as people come to it, to back off a little bit. And that feels like we are doing what our charge is as an ADRC, is kind of throwing ourselves out there to be a help. And we're still a major part of that group, but we're not, we felt like we were the part, like we were it for quite some time, you know?
Yep.
So it just feels, how long have we been going at that now? It's
3 years.
Yeah, I would say, yeah, so we've had successes, and still a lot of people, you know, I think I say this quite a bit around the table here, is people think if they reach out to us that that's gonna be the beginning of the end, kind of, so to speak. Like, if I reach out, they're gonna take me to a nursing home, or whatever kind of crazy thought they might think about us. We're here to help you stay in your house, and how do we do that? And that's not always how the public perceives us, to be honest. So it's good to have partners that some of those people can just be referred to the senior center and don't have to go to the old county.
So that's another reason why it's nice to have 211 making that initial call, because some people see Winnebago County come up and they just won't answer for whatever perception they have about us. And 211, I think, is having more success connecting with people, which is helpful. Although if it comes up United Way, people might think it's fundraiser. So sometimes people just don't answer either way, but they do follow up with a letter, and that's been good. Some people didn't use us for fall prevention. They used us because they had some memory loss and ended up engaging with some dementia services, or another person wanted a power of attorney assistance done. So we helped them develop their power of attorney. So sometimes it's not necessarily directly related to the fall, but at least we're connecting with the people. Corinna, is there anything you wanted to add, to seeing that you've had more direct experience than anybody?
Oh, there it goes. No, I would say that you said everything. I think it's been super helpful that 211 is now involved, just because we weren't getting a lot of answers, and it seems like maybe they're the best people to kind of connect people where they need to be.
Yeah. Do you remember when we started? Was it 3 years ago?
Yeah, it was 2021 when I started, because I took over when I started, so 2021.
Perfect, thank you.
Not to put you on the spot, Corinna, but do you have any idea of how many kind of calls we still get on this? That's a number I don't necessarily know. Like, Corinna used to take all the calls at one time, and that got to be too much. So we spread it out to be our on-call worker so that we could spread the wealth a little bit. Do you have any kind of essence, how many of those we get, maybe a month or?
I don't know what we get now since 211 took over. I know that it's decreased quite a bit. I don't know that anyone's had a false call recently. But we were getting, I think, almost, sometimes it would be 5 a day, so like 30-ish a month, I would say.
Yeah, I would say between 20 and 30 people give consent to engage. But again, we just 211, connect with all of them, know, and when they do, they don't all come to us.
The fire department keeps a really good,
Yes, they-
Erin sits, my coworker, Erin Roberts sits on the team too. And she said that
Aaron
they,
Roberts.
Erin Roberts,
Is it a man or woman?
Not
a woman,
Rogers.
Roberts,
Not Aaron Rodgers.
Roberts.
No, Aaron Roberts is a police officer.
Oh, so I mean, there's someone at the fire department that really keeps some good data on the falls and actually the follow-up. So, we do a really good job in Wisconsin to report, and that's why we're probably number one, because we do such a good job to report. We do have to remember that, because there are states that don't, but we also have weather, we have ice and things like that too. So I think, you hit it on the spot, 211, it's nice to fill the gap, and once a gap is, that's what public health does, that's what we do as a county entity, we fill that gap, and once we can pass it along, that's a really important thing, and that's, I think it's really grown, and it's actually, fall prevention has been going on for quite a long time.
Yeah.
Yeah, and we at the health department have the nurses go out and do a Stay Active, Be Confident. It's a fall assessments that we can go out, and they're also offered that too.
Yeah, we had those falls brochures done more than a decade ago.
Yeah, it's just getting people to feel comfortable to have someone come out to their home. That's the hardest thing, so.
And I would say probably just as many people agree to have public health go out and do a falls assessment in their home as they do to the ADRC. You guys get almost the same number of people that agreed to that they do for us when we last looked at that number. So I didn't print out any statistics because there's lots of different ways to slice and dice where a person fell, the gender, the age, so what I did is I put the website on the agenda here. So if you go back to the email that you received for this meeting with the agenda and you click on that, you can go in and find out just about any kind of statistic related to this that you want to. I just figured it'd be easy if you wanted to go that deep with it, go ahead. Otherwise, if you aren't interested in going to the website, but you have a specific number of something you're looking for, just send me an email or call me and I can get that for you. And then lastly, if you like old fashions and you like to support agencies that support endeavors like this, I put some of these up over there. There's an event this Friday over at the Timber Rattler Stadium, and it's an old-fashioned tasting. There's going to be tasting of old-fashioned drinks, appetizers, games where you can win things and all kinds of things for $40 a person, and it's to support Rebuilding Together, who puts up the grab bars, and they get, again, just as many referrals as we do to assistance, but they're starting to run out of money. So if you have an interest in this, grab a brochure or a flyer from up there.
They're providing rides home.
Yeah. No falling alone.
Yes,
Just to taste one.
That's a really
Big
one. Only one.
Yeah. So I don't know what that means, if they have different flavors or I don't know. You could probably find out, but I just wanted to let you know about the event. Any questions on the fall prevention?
Okay, thank you very much. Next, we have dementia updates.
Okay. I think the last time I was here was in November. And I had mentioned that we were working on a dementia awareness campaign with Fox Valley Memory Project and the Alzheimer's Association. We had received, or Fox Valley had received a grant from the Oshkosh Community Foundation for just getting the word out. So we're trying to connect more of the community with all the dementia programs. So we had an ad put together, and ran that in the Oshkosh Herald, the end of October through all of November. And there was also some Google ads and some funding put in to draw people to the landing page, which was on the ADRC website, the dementia webpage that was redesigned. And so we recently just had a meeting to kind of talk about like, how is it going? We've only spent half of the money that we actually have, but we looked at some of the data for the traffic to the website. And it looks like in September and January, they were actually, even though our ads were in October and November, September and January were our highest months with traffic. We had 543 people go on the website in September, October 440, November 406, and December dipped down to 102. But then back up in January, it was 515 people hit that website. And so the areas, because they're divided in different, we have different web sections or topics. So the ones that were hit the most were caregiver support, caregiver respite, prevention and brain health, and diagnosis. So it's interesting to get that data so we kind of can focus a little bit more on what are people needing more information on, and we'll just kind of continue to track this, and we're going to do more marketing, researching just other ways to get the word out for all our programs. So that's just kind of an update on that.
Were those unique visits, or were those, would that have been the same person coming back?
I think they're unique. I talked to our IT person, and he was saying those are singular. So yeah. There's some way that they figured that out, and I have no idea how that works. But yeah. So that's some good information. Just some updates, just related to all the different programs that we have in Winnebago County. We made some changes to some programs, and there's an updated sheet, and this is all kind of updated too on the website. But we moved around some of the memory cafes. Just to make some changes to see if we could draw more people in. The Menasha Senior Center now has the Menasha Cafe as opposed to the library, and they moved it to a different date. There was some overlap with different cafes, and so someday you would have three and different communities, and so we just really were trying to look at spreading that out so people could go to more cafes if they wanted to. The Oshkosh YMCA continues to have it at the 20th Y, but they moved their day and their day of the week. And then the library no longer has the cafe here in Oshkosh. We made that a traveling cafe. So we're moving it to different locations in the community each month to try to partner with other organizations and get people into some just different places. So this month coming up, we're doing it at the fire escape, and people are going to do some pottery. We had the first one at Carmel Crisp just to kind of talk with everybody about their ideas, and that was well received. So continuing to do those cafes in partnership with Fox Valley Memory Project and all the other entities. There's some new support groups. There's a new support group for dementia caregivers at Bella Vista that started this year. There's also one for another one that was added to the Fox Valley Memory Project for people who are caregiving for frontal temporal dementia individuals that have that disease. So there's still quite a number of support groups out there. The men's caregiver support group at Cafe Nutrition is going very well. So those are all listed on the sheet. And another program that was around back in the day before COVID has kind of come back. It's called Lyrics and Laughter, and that's at the Valley VNA. So they're running different sessions, but they have a session from February 7th to the 28th, then one in March to April, and then one in May. But it's every Wednesday from 1:30 to 2:30 for people with memory loss and their caregivers, and they use music as a way to, enjoy their time together. So I might have missed something, but that's kind of an update on the different programs. I went through, the dementia care specialist had a grant and some of us had the opportunity to become trained in Savvy Caregiver, which is you could do it as a class or you can work individually with people. But it's a training to work with caregivers to understand. They become much more educated in what dementia is, understanding the different stages so they can learn about their loved one, where they're at in stages. And so the goal is to try to find activities that are suited to their capabilities and their interests. So it's kind of using what they call contented involvement. So you're keeping your loved one involved throughout the day. So to try to meet their needs and find them meeting, have meeting in their day. And so it was really fascinating. It was very time consuming, but I finished up and got certified in that right at the end of the year. So hoping to use that with caregivers because it's a really fabulous program. Doing a new round of training with the Dementia Capable ADRC, the 4 modules of training, the Dementia 101, 201, dementia programs and memory screening so that some of the new staff get trained. We have we have a new intern that just started, so he's coming to the trainings, and then some staff that have been around for quite a while are getting trained. So I run that a couple times a year to make sure that all the staff are pretty capable in doing all those supporting people in the community with dementia and all those areas. One of the other things we're kind of looking at and getting some information on is a brain and body fitness class for people who don't even necessarily have to have a dementia diagnosis, but who have some kind of memory loss, doing a fitness class, and it's a social opportunity to meet other people. And so talking to the YMCA, seeing if they're interested in partnering with that. They're doing that in a number of other counties. Brown County has a successful program. I've been talking with them about that. And so that's something that Nicole and I have kind of been talking about too for this coming year. So, and then we're in the very early stages of planning a caregiver conference this year in November. So just had our first meeting today, and we're hoping to have a great conference for dementia caregivers in November in Oshkosh. So more to come on that as we get rolling. So we had our committee form, and so we all got our task. We're trying to figure out where we're going to have it. We have a presenter in mind, and then we're kind of thinking of doing like a caregiver roadmap kind of a model where we have people from the community that are in hospice or in home care or assisted living who can be on a panel and just kind of explain how to plan for the future. So just different ideas that we're kind of looking at that have been successful in other counties. So I think that's it.
May I pop in?
Yes.
If you have dates, even if it's just tentative dates, I can block our conference area here at Fox Valley Tech. It's open, you don't have to pay to use it because you're in the community, and we have a beautiful conference wing actually. And you can get breakout rooms and then the big room and all that stuff. But obviously because it's free, it gets filled up. So let me know if there's some dates, and I can get my office to block it for you at least if you'd like. So
yeah, we just started talking about other venues. We have we're going to be touring the Culver Center at UWO, but we were talking about that today and actually would like to set up a tour to go over there and check that out. Would that be something we would set up with you, or is there a contact that?
No, I would put you in touch with, there's I think it's Teresa at the foundation if you wanted to do all that. I was just going to block the rooms for you, but she can handle all of that for you. But because it's nonprofit, it's government, et cetera, then you guys could do that, assuming it's available. So.
Yeah, I think we want to see the venue because we also want to have like the virtual dementia tour as a part of it, and like a respite area for people. So we need a number of different rooms. So we have, we'd love to take a look at that and check it out.
Well, if that's the case, then I'm sorry, what?
I'm just gonna ask you to send me her contact information. I can get it to Elisa.
Okay, yeah, it's just the Fox Valley Technical College Foundation. I'll see if I can figure out who at the foundation would have it. No problem. Yeah, I'll just shoot it over to you, Beth.
Thank you.
Great, thank you. That's wonderful.
Elisa, speaking with, virtual dementia, how are the numbers of people attending that? Is that still?
That was one of the things that we switched it to a different day and a different time because we were hoping to get more people. All of last year, I think we put through 93 people. But we're struggling to get caregivers to sign up for the tour that's set up at Parkview, the once a month, a Thursday, or it's now a Tuesday afternoon. We've been running through some, when we have openings and it's right before the window kind of closes, we've been filtering in staff from Winnebago Mental Health, and they've been going through it, but we spent some money that we had left over in the AFCSP funding pot to buy more equipment. And so we can actually now, we typically put through 2 people at a time. We are gonna be able to put 9 people through. So we're trying to make it something that we can bring to organizations and businesses, or we want to link up and provide it to people in a targeted way, because it sometimes doesn't fill up, even though we've been marketing it everywhere. So
How long does the training take?
so you go through, it's 8 minutes that you're actually going through the experience, and then we debrief afterwards where we just kind of talk about how the person felt and do some education. And so for family caregivers, sometimes it can be a half an hour for the whole thing because it can be kind of an emotional experience. For staff, it goes a little bit quicker, so I would say a half hour is kind of the time slot.
How do people sign up?
So we have it on our website. I have flyers with the scan code, and it's basically just signing up, or you can just call the ADRC. But it's offered just one day and time a month out at Parkview Healthcare. So
You said that's Tuesday
it's the
afternoon?
second Tuesday of the month from 1:30 to 4:30. So tomorrow afternoon, and we have slots that are.
What is it actually? It's like something they participate in, or it's?
Yeah, we actually, it's a licensed program, it's evidence-based, and you will pretty much, we alter your senses in a way that is mimicking dementia. So you kind of go
Virtual
through.
reality with
Yeah,
goggles?
it's, it's funny because it was called virtual dementia, but now that we've had COVID and everything is virtual, it's very confusing.
sure.
You're in person. We're putting different, we're altering your, I'm not gonna give it all away, but we're altering your vision, your hearing, your senses. You're supposed to be doing things. You're given instructions, and it's kind of it simulates dementia. So it's kind of a powerful experience.
It's really eye-opening, and when you say it takes about 8-10 minutes, it feels a lot longer than that. Because
I did it too.
It's so frustrating to have all of this going on, and it just gives you really good perspective.
Yeah.
Interesting. Okay.
One of our staff, I would consider a real go-getter. She just kind of, takes stuff on. When she went through it, she just stood there. She was just like, I can't do any of the stuff you're being asked to do. So she just, so you can imagine, it gives you that feeling of what it's like when you experience dementia and you're not responding to a person who's asking you to do something.
Sure.
Yeah, it can be very, very emotional. I don't know if Menasha Public Health is aware of this, but you guys can sign up anytime and experience that. Thank you.
We did it as a team, as part of our team meeting. Elisa ran us through it and some of the trainers, and then sat there and debriefed, and it just gives everyone, we get going so fast. We're part of our job, and sometimes it's easy to forget what someone's going through on the other side of the table, so it was outstanding.
Yeah. And because Parkview had a wing that was closed, we have a couple rooms set up for this. They use it to train their staff, and we use it for community members and any family members that they have that are have their loved ones there. But we can bring it to people too, to put through more people at the same time. The room's so small that we really can't fit that many people. And so that's, again, the goal is if there's organizations that are interested, and we're starting our list, and yeah, we're willing to bring it to further educate people.
You said that 3 hours, it's like about 9 people you could get through, or how many?
Yeah, I mean, our time slots are, I think every, what do we have at 20 minutes now? I think so, yeah. Here's the flyers. I can pass these around. I don't know if I I can pass around all of these. This is the program list of just all the current things that are going on, and this is the flyer for the virtual dementia tour. So, let me just.
Alicia, if you were to take the equipment on the road and go to, say, Menasha, I'm assuming your staff go with it?
Yeah, so we have, and that's the other thing, we're having 2 more staff trained to do the debriefing because you have to be specifically trained to do it. Like, we could get volunteers to help with part of it, but we have to be the ones that talk to people afterwards to explain, you know, that education piece of what they went through. So, so yeah, we'll have staff that, we have 4, 5, 6, 7, we have about 7 staff dedicated that kind of rotate through.
The reason I was asking, the way I'm asking is if you were to take it on site to another location, would they be able to have it for 3 days? And do you have the staff to support something like that?
We'd have to talk about that. I mean, if it's like hundreds of people, like we could talk about how we would do that. And so, again, this is something we're gearing up for this year, but we really want to impact as many people as we can. If it was 3 days, like that would be a lot. I mean, for 3 full days to put that many people through, we maybe have to spread that out because these are mostly ADRC staff that have other responsibilities too. But we certainly want to make it happen in whatever way it is possible.
And our former chairperson is one of the volunteers, so if any of you wanted to volunteer, I think that's helpful too. And also just spreading the word. If you are talking to someone who you know is experiencing a family member who has dementia, make sure that you're letting everybody know. Let them know about our website, about the programs, about the dementia live experience. You know, if you could just kind of be a spokesperson for these programs, that's really appreciated.
Well, Lisa, that was a lot. Any more questions? You're busy.
Yeah, thanks.
Thanks for everything that you're doing.
Yeah.
Okay, agenda and questions for the legislators in March.
So I did get agreement. They're not in session for our next meeting, so they're coming here. And I wanted to just kind of have a format of what kind of things that you think, because I want to prepare them too, like what kind of things would you like to hear about or would you like to share with them? I was part of a meeting this morning on funding for ADRCs, and there were a lot of examples of ADRCs which shared specific stories about people that went through their ADRC. There's some perception, I think, that if the ADRCs get more money and serve more people will enroll in family care, which is more taxpayer dollars. And the stories that people were sharing were more so how they help people spend the money that they have so that they didn't have to go into long-term care, or how we support caregivers so people can stay in their homes and not go into nursing homes, which is on public money. So I think we should be thinking about, you know, ways that we help people that aren't necessarily just related to long-term care, which is part of what we do. So I didn't know, again, if you had some ideas that I could share ahead of time with people about things that you want to hear about or things that you think that we should share with them that they should know about.
Can you first share who's coming?
Yeah.
Lee Snodgrass, Lloyd Palmieri. Sometimes it's someone from their office. I can't guarantee, you know, that day comes up, and if something else comes up, they'll just send somebody. What's his name? Sorry, mental block. Michael Schra.
They're all state assembly people, or not Congress people.
Correct.
Okay.
And the funding from the ADRC is allocated through the state. So they did approve some additional funding for this biennium, but believe it or not, come April, people are starting to talk about the next biennium and budget. And so the sooner we can let them know what we are, who we serve, what we do, when they make those votes, the better. So.
It's not ADRC, but I always go back to APS. More APS workers in our state.
Yes, lots of efforts going on in that regard as well.
I can just say, I think the caregiver stories are really important because that's, I mean, there's so many caregivers out there. And you're right, it's not just long-term care, it's all these programs and, you know, hearing from them. I know they've been doing some listening sessions throughout the state, some other dementia care specialists talking about that and just how important it is when they have that opportunity to share their personal story. It just makes it so much more relevant and, you know, and
And that's the stuff they remember. They're not
Yeah.
gonna walk out of here remembering statistics. They're gonna walk out of here remembering that kind of stuff. So if you know of someone who would be willing to come, I think it's March 14th, that would be great. Or if you have a story you're willing to send to me that I can make sure I share, specific to dementia caregiver, that would be really good. So some caregiver stories on, any other thoughts? What we want to share or what we want to hear
I thought
about?
one of the challenges is getting people hired.
Excuse me.
Low pay for demanding jobs.
Mhm. I don't know if you heard, but Governor Evers just passed initiated a task force on hiring, looking at the caregivers. And, you know, I've shared this with you guys before. Sheer numbers aren't there. We have, as of this year, every baby boomer will be at least 61 years old. So many of the baby boomers, where we have the highest, of course, percentage of or number of people born, are retired. So they may still be working, but most of them are retired. So, and some of them are already into the needing caregiving age or stage of their life. And then the birth rate is about half what it was. It used to be, I think, 26 out of, for every 1,000 people, there was 26 babies born, and now it's 10. So and that's been dwindling down. So there's fewer people entering the workforce and the greatest number of people ever leaving the workforce. So part of the caregiver thing is numbers. And so Governor Evers just real recently appointed a task force to start looking at, like you said, the pay, the job, the, you know, kind of how we as a state can help.
I just read that there's a new course for caregivers. First, I believe
Yes.
CNAs, it's a fast track kind of.
It is. It's to provide additional training so that they're better equipped to do their jobs. They get a certification, so we're trying to elevate the status of caregivers because people are like, I don't want to be a caregiver. You know, trying to look at these are important, critical jobs in our community. And then there's a sign-on or whatever once you're doing the work for $500. And then if you already are a caregiver and you go through the course, you get $200 or $300. So again, there's definite initiatives happening to try and address that, you know, just inching toward how could we improve and increase the caregiver supports in our community.
Art just had a article that they put out last month too about caregivers. And they have a support number that you can call to, I don't get your name on, or there's money available that somehow they're kind of involved in. And I had it at home and I forgot to bring it.
That's all right, yeah. Other thoughts that I should kind of prep them for?
I think part of the shortage of caregivers is the amount of money that they make. And I don't know if there's what the legislators can do about that, but if there was a way to raise the minimums.
Well, they did a 5% across the board increase 2 years ago, year and a half ago, something like that. So they do have some, and that was a requirement, and it all had to go directly to the caregivers. It couldn't go to the administration of the companies. It had to go to the caregivers. So they do have authority to impact the pay. The more they hear about it, the more they're likely to do that.
Well, I think that would be a really important topic.
Yep.
I know a young gal that's a caregiver now, and by all reports, she's very good at what she's doing, but she's not making enough money, so she's going out and becoming a cleaning lady.
Yeah. See, the Schwa just initiated a bill to help counties with something relating to children's services. So, you know, if they feel passionate about something, they will introduce bills to make a difference. In fact, Mike Burkast, who is now part of the Fox Valley Memory Project, was a legislator, and he had initiated some bills that made a difference in the dementia world. So they just have to hear about it and hopefully trigger them to, you know, do another increase or whatever they feel is appropriate. Jerry, you were.
Yeah, I'm at the age now where I have a lot of acquaintances who are starting to recognize that these are problems in their families. In fact, I have relatives that are going through this. And Brian, when you brought up a few months ago about respite time that you get people away and they can come in and we would help with that or something. I'm finding, I've talked to people, but they're in denial about whether or not they need this or if this would be beneficial. Is there something out there to help people understand that, yeah, you might really need this? I don't know if I'm clear with.
Yeah, I mean, NFCSP and AFCSP are grant funded. They're grants that you can get to have that little bit of support so that once you do get someone in the home and you realize how helpful it can be, you know, the criteria is, you know, to try to help as many people as we can. I mean, there are some financial constraints and income limits, but yeah, I don't know if you want to speak more to that, but.
Yeah, I think, you know, with these programs that we talk about quite frequently, caregiver programs, they are a beautiful way to get people used to the concept of care coming into their home. And that, you know, they have to be ready for that. That's not an easy thing for a lot of folks. That's quite common that people are, I can do it. I signed up at the altar, for better or for worse. This is the worst part. And they don't understand that they could get a little help. But we don't have to ask a lot of questions. There are certainly some financial parameters, but we don't have to jump into assets and all of that stuff. We can just help. And to the extent that we can find an agency, we can help pretty quickly, like within days, versus some of these longer term programs take a month or so to get hooked up with medical assistance and that stuff. But I think I speak for my colleagues here. You know, you could have someone call our team. We have an on-call person, but any one of us would take that phone call if someone has questions about that. I'd be happy to take that question. That's what we do. So if we can kind of have a little success with getting someone to just give it a try, once I think people understand that I don't have to be with my loved one, I can go and read a book or do whatever. My dad used to go fishing. We could drown a worm, and just to not have to worry about that for an hour or two is just beautiful. Once they get into it, I think it's a slam dunk. They love it.
Yeah, I get calls like that every now and then of someone who's like, I can't get someone to acknowledge they need help. Some of the other suggestions would be, there's a website called Respite Care Association of Wisconsin. And so if they just wanted to delve into kind of reading a little bit more about it and figuring out why is respite important, why would I even want to do this? Elisa mentioned some support groups. I think that support groups are a really good way. So if you're talking to somebody else who's walking in your shoes and they're saying, oh, you wouldn't believe how much that 2 hours a day makes it for me, or that hour a week, or whatever it is. So to hear from other caregivers is really powerful. And if they're not comfortable going to a support group, there's virtual support groups where they can learn more about the power of respite. The other option would be, we've got a church across the street from the Nina Menasha YMCA and one behind the McDonald's over on Jackson Street here in Oshkosh. So each community has a church who opens up a couple days a month where you can drop your loved one off for a couple hours and go shopping, fishing, whatever you're gonna do. The cool thing about that is you don't have to fill out a bunch of paperwork. There's no financial questions. It's basically what's the emergency contact. And so your loved one can go there and they do different crafts and music, and there's volunteers to spend time with them. There's a CNA on staff, on duty or whatever there in case something goes awry. But that way you're not like engaging in a program. You can just try this little 2 hour window or half of it or something, just to see if that's something that you might benefit from. So those would be three of the other ways to help a person kind of inch toward acknowledging that the power of that kind of help.
What was the name of the first program that you had mentioned, the introductory?
NFCSP, National Family Caregiver Support Program. And the other one is just an A in front of that, that's Alzheimer's, that's what that stands for. And we also have plenty of materials that we could send out to people or give to you. If you have an in with your buddy and you're thinking, hey, Joe, you need this, and you've got a special kind of bond where you can talk to them on a different level, we have stuff upstairs that we can get you to kind of segue into that conversation.
I'll shoot you an email, Brian.
What's that?
I'll shoot you
Yeah,
an email.
please do.
So when we're talking about the legislators and what we would like to see them do, I heard you say that more APS workers, more money for APS. And if stories are what does it, I've heard over the years, you shared some stories without names of this person who needed this, and that's how their story went. I found those very impactful. So would it be appropriate to have a couple APS workers in here to tell a story and why more APS workers are needed?
Mm-hmm. Yep.
I mean, the stories are what stick with you.
Yes. Yep, absolutely.
So if one of the goals is to get more funding, that might be a way to do it.
In fact, I have a couple of joint APS ADRC stories that would be pretty powerful. Yeah.
And all the scams that are going around out there that
I think different presenters to present each one of those things with a goal in mind of, is it more funding, probably mostly more funding, or more opportunities.
Yeah, and like with opportunities, one of my asks is going to be with the AFCSP program, there is a minimum income and it's $40,000. So that was developed 20 years ago. So back then, $40,000 was a decent income, and the premise of that program, because it's state funded, was if you've got the assets, then you're not eligible for this. Well, $40,000 now is for a couple or a family of three is basically poverty level. And so not as many people are eligible for AFCSP because of that weird income level that hasn't gone up ever. So I'm going to say it doesn't cost you anything to increase that level to 50,000 or 60,000. More people will be eligible for the funding that's already there that we can't access.
How about, could you ask for a sliding scale in addition to that? So that people who couldn't otherwise afford to hire that outright, that you'd have your minimum income that needs to be changed. But then if you institute a sliding scale,
right,
so that people can pay as they're able.
Yeah, because
Wisconsin senior care, the prescription thing, there are levels that you qualify at. Some people need all the help they can get,
right,
and others don't. Right, you have to pay a little bit of your way. That's really
because if you have a couple of two people living together and they're at say $45,000 a year, they're not going to be eligible. And now pay on a weekly basis for caregiver support out of that, it's not feasible.
Well, it's not, and so you're missing a huge group of people that need this help.
Yeah, there's people with a very high income that can afford it, but there's a chunk that can't. All they have to do is, again, it's state funding. They don't have to go to the feds. Change that AFCSP income level and or institute a sliding scale. We could serve more people with money that's sitting there right now that we can't use.
I think that's a slam dunk. That ask is a slam dunk to me. Yeah. Sliding scale and change the minimum.
Yep. So those are the kind of things, what I don't want them to come here because we're asking them for money. They need to understand what we're doing so that when there are budgetary proposals, they can vote well. But also just anything like that, any programs or any changes that you can think of that would impact our system, we can plant those seeds.
Well, I think the stories really carry the weight.
I could take that. I have a team meeting tomorrow morning. I think our ADRC specialists could give some good stories as well. like to piggyback on what Beth was saying about, we shouldn't just be a pipeline to family care, but that exists for a lot of people. They need that level of help. And I think I speak for my staff. I hear this at check-in is that the people that like the planning and how to help them with their own money and stuff like that. There isn't always a lot of time for that because of the time taken up with the public, the family care and IRIS, kind of. There's a lot of time in an INA's or ADRC specialist day to be able to.
We talked about that this morning at that financial call, yeah.
We're certainly doing it, but are we going as deep as we need to,
Well, and just following my train of thought here is if you have someone stand up and say, this is what I do, this is what my day looks like, in really short, and then they tell a story. And somebody else can stand up, and this is what I do, and this is why.
You could get a couple people, I think, to do that. Great.
We'll volunteer Coretta.
What brought me to you, Beth, originally was my uncle lived alone. He didn't have a spouse or anybody with him. And as a nephew, he had nowhere to go. He didn't know what to do.
Right.
We didn't know what to do. There really aren't programs or there wasn't anything for us to do because we weren't really technically legal people to him. So to ask questions, how do we find answers and that? And it was it took a long time for us to figure out how to get anywhere with anything with them. And he's not alone. There's a whole pile of people like him out there.
Well, and there's lots of things that I've learned here, like how you get your power of attorney. You guys can help with that. You guys can help with all of these things instead of going to an attorney. It's in place. You're trusted. What's that trusted person or whatever that?
Supported decision maker.
Thank you. I remember what it does, maybe not what it's called.
That's all right.
But those are the things that I think are important for them to know that you do. To have the framework of an ask.
I think having the stories is an amazing idea, but if we as a committee have questions or if our staff has questions for them or things they want to impart to them, could we potentially come up with that sooner and give that to them before they come? So not so they can prepare a defense, but so we can have good conversation rather than kind of being,
yes.
Oh crap, what is this question?
And that's why I'm asking, that's why we're talking about today is that I want to give them a heads up of the kinds of things we're going to talk about and ask about.
Well, my daughter is a caregiver. She started it on her own. And her last client, she just got from a grocery store. Just because this older lady just couldn't do, pick the stuff up off the shelf and stuff like that. She was like 94 years old, whatever what she is. And I don't know, she got involved in it. So as of January the 1st, she's now a full-time caregiver. So but she gets paid by 2 different organizations. And I don't know who they are. I don't get involved in it, but
kudos to her.
Yeah, it's really interesting because a good caregiver is going to get, even by that caregiver, by giving that care, it's word of mouth.
Yeah.
So, hey, yeah, Michelle does this stuff and blah, 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 blah. So I think that's a good thing. And, but she just got pretty excited here lately. I guess she got a raise on both of their annuities or whatever. I don't know, but, and then of course she's looking for more clients, but she's not specifically working for somebody, like.
Yeah, so the Respite Care Association of Wisconsin does keep a list of caregivers and people that need care. There's care.com that you have to pay to go on to advertise that you provide care, but Respite Care Association of Wisconsin does not charge you for that. So,
oh, really?
Yeah, so she could go on to that, contact them if she wants to get more people to care for.
Okay, I can tell her that.
Is there a licensing requirement for somebody like her?
Yeah, but she is going to school for that now.
Okay.
Nice.
She's gonna do the school part of it, and she expects me to take care of the deck,
We all have a part of
Yeah,
this.
yeah, I was just gonna say, it's for the greater good.
What is that? I says, how did I get hooked with that?
Yeah.
Holy cow.
I'd like to kind of interject something. I'm on the Parkview Health Committee. There's a list of people waiting to get in. There are no people. We have thrown the money and it's been okayed by the board, which I thought sometimes it wouldn't be. There is just the shortage of people.
They have 2 wings closed down because of lack of staff.
Right.
And
Yeah.
a long waiting list of people to get in.
And there is,
Yeah.
I forgot the shortages, but it's like 50-some nurses' aides. I forgot how many RNs there's a shortage, and they're making good money. The RNs for sure are. But somebody brought up, and this should maybe be brought to Lori, that why don't we let some of them, I don't want to make political stuff here. Why don't we let some of them people from across the border come on up here and get them to work? They'd be happy to do the job.
Can I jump in here? If I can jump in. Fox Valley Technical College used to have a very robust program. It was a program that taught new immigrants how to be nurses' aides. Specifically, it was especially well, I mean, we had large numbers of people who would enroll in that program who came from communities or cultures where caring for the elderly was considered honorable. In fact, it ranked higher than being a firefighter, et cetera. We had lots and lots of students, and that program shut down for various reasons. And you can imagine many were political, not all, but many. And so it's important to understand that that is something that would be an option possibly. I don't know if it's through our college anymore or that kind of thing, but we had a very robust program. It had not only the training, but also then it was the participants would learn English for healthcare and that kind of thing. And they had to, and then they would also work on their GEDs, et cetera, that kind of thing. It was, I believe, a partnership between Fox Valley Technical College and like World Relief or one of the, don't quote me on that, but one of the immigrant assistance organizations, I think, with associated with religious organizations. I don't know. That's not my area, but I do know that we had a very big program because I used to help the faculty who were building and updating the curriculum for that program quite often. And so I think you are spot on in your assumption that there may be a potential there. But I don't remember the year it essentially, I don't know that it's completely shut down. It may still exist just with small numbers, but we used to have large numbers of people in that program.
Thank you.
Maybe that's something the 2 assemblymen can work on. I don't know if that's within their jurisdiction or if you gotta go to your congressman.
Well, just for them to support any endeavors to get more immigrant caregivers. There's agencies themselves are trying to tap into that workforce because not only is it a great employment opportunity for the immigrants, but there's more and more immigrants needing care. And so if someone speaks their language and comes from their culture, they're going to be a much better caregiver. So I know little bits here and there done, but we can certainly bring that up also.
Okay.
And then back to along the lines of what Jim was saying, when Brian talked about, how deep are we able to get with people when our workloads. So the call today was these astronomical numbers that the whole state is experiencing with calls and referrals. And Milwaukee County has, I believe it's a 3-month waiting list to even meet with an ADRC specialist. 3 months. And so, throughout the state, we're finding that we just don't have the capacity. And yet people don't know about us. So first of all, I don't have the staff time to go out promoting us because they're too busy doing the work. And if I did, and they're promoting more referrals, we don't have the staff to deal with them. So the fact that we're still the best kept secret is a problem. But everyone's like, I'm not gonna say it. We do promotional things all the time, at least once a month. But in reality, we're not pounding the pavement to make ourselves known because we're struggling with the amount of referrals. So we want people to know about us and be able to support people. But if they don't provide the funding to bring on more staff.
Amen, amen.
What percentage of staffing costs is covered by the state and versus the county? I mean, is there a split? Is there?
Yeah, the county doesn't really put anything into this program. It's pretty much federal and state. Federal because some of the activities that we do are related to Medicaid.
Okay.
And so depending on how they do their 100% time reporting, we can draw in Medicaid dollars. And then depending on how much of that we need, so let's say we spend $100,000 one month in staff costs. If we could draw in 10,000 of Medicaid related dollars, then we only draw 90,000 from our grant.
Okay.
And so we get a grant of like 1.3 million from the state to operate the program. But when you look at the needs, you know, another example would be our dementia care program. So we are a county that gets $80,000. Well, if you take Elisa's salary plus fringe benefits, plus the advertising, plus all these things she's doing and travel time and promoting this and the pets that she's working with people on, well over $80,000. So that all comes out of the grant, you know, so they give us all these little pots of money that all come into a big grant, but you're kind of robbing Peter to pay Paul to make it all work.
So nothing comes from the county?
In 2022, quite a chunk came from the county. It wasn't a lot, more than usual. 2023 was pretty close to a wash. I think we came about as close as we could to spending it without going over. Maybe we went a little over, but there's not a lot of county funds in it.
One of my idealistic dreams kind of, since I've been here, is for the ADRC and the communities around us, i.e. Needham and Ash and all of them, to become a voice as one united, in a sense, to kind of get together on all of this. And I'm wondering if that might not be something that perhaps you and Christine should talk about too, is the input from Christine to the legislators. And if I carry that point just one little bit further, is, are you going to ditch this agenda and just have one single agenda item for next month?
Yeah.
Okay.
Yeah. All other agenda items. And it might still go over. Sometimes they get to be quite lengthy, especially since the legislators themselves often share what they're working on. I remember when Gordon Hintz was here and he was telling me about different initiatives he was working on, and he was part of the joint finance. So, you know, it can be a little longer, but yeah, that's about it for next month.
Liz, you had something?
Yes, I just had a question. So obviously I fully support the idea of having a message about funding for the ADRC. What I missed, and I apologize, sometimes the sound doesn't come through as strong. Is there also an effort to talk about like funding to individual families, or are we focused on the agency? And I'm very happy to be focused on the agency. Otherwise, I would like to share with you what I thought I would share about individuals with disabled loved ones that I would bring up. But if there's not time, I'd rather us focus obviously on ADRC funding, because that's critical. I couldn't hear the first part about whether or not there was going to be a mix.
Yeah, it can very much be a mix because you guys represent the people that we serve.
Okay.
So anything that's going to impact the people that we serve, whether it's direct caregiver funds or supports for individuals like your son, transportation, meal programs, you know, anything related to the people that we serve, that we can help them better understand. Again, when they come to do voting on things, the more likely they are going to support us in whatever.
What I'd like to share with you is something that we've discovered is that many of the funding streams can, are available depending obviously on someone's capabilities. But I keep forgetting where to look. I guess I have to look there. But it does seem like the state has a lot of some restrictions on, I'm going to say, on creative alternatives. So I'll give you an example. There is a college in the southern part of the state that teaches not only job skills to people with disabilities, but also living skills. The individuals live on campus, et cetera. Obviously, that's expensive. It's $62,000 a year, actually. And there is no mechanism for parents to be able to take out loans in order to pay for that. So you have to come up with $62,000 a year for 3 years. And so the idea would be to encourage, like what I was hoping to ask them was to ask the state to just have some mechanism where people can propose something that an alternative to just having my son, for example, live in a group home or something like that, where he can develop a job skill that could even be supportive for him, so that his, if you will, ask of the community goes down, 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 down instead of consistent. That would be my thought, but I don't want to hijack it and have it be like, well, what college is this and all that kind of stuff. I'm happy to instead put that in a parking lot and just contact them directly. But if there's time, I'd love to be able to share that as only an example of the kinds of things that families could propose that are different than just your classic options for people with disabilities, if that makes sense.
Makes a lot of sense to me.
Yes, it does.
Thank you. Our goal is for Clayton to have to pay more in taxes than he ever takes. It's not happening right now. He does pay income taxes, but he only has a part-time job. We want to anyway. And so that's what I hope to put together. I won't talk even as long as I am now. What I'll do then is have information that then could be sent in a link or something, but thought that I would mention it. Because I don't want to hijack the conversation. I can be last, so that if there's any information, because I know it can be the shiny object that then people go after, and I'm not trying to do that. Speaking of, because then I'll stop talking for the rest of the meeting, I did post the contact information for Teresa Tuschel, who is the contact at the Fox Valley Tech Foundation for Community Engagement and Events Planning. So
Yes, I saw that. Thank you.
You bet.
To kind of wrap this up, how do you want us to get the questions? Like, do you want Liz to put something together that you can share with them? Because here we are, it's almost the middle of February. And we're a month away, and if you want to get it to them early, what do you want that to look like?
In the past, so we used to have them come every year or two, and in the past, it was very open. It wasn't very scripted at all. And it worked well, because they could, again, share things that they were working on, and we could just share the stories.
Would you just want some high-level topics that we'll touch on, or?
Yeah, I think if you want to send me some high-level topics by the end of next week, then I can.
So that's open to everybody?
Yes.
Plus what you've already taken down.
Yes, I did write down notes about what everyone has said. Yep. That I will share with them.
So if anybody has anything else to add, that's how you want us to do it?
Yep, just send it to me and I'll add it to my list.
Okay.
I'll get this to them later next week.
Okay, great. Thanks, everybody. That was a good discussion.
Thank you.
Okay, next is the wheelchair wash. Right back to you, Beth.
Well, I was going to announce that it's August 10th, because then I know for sure we have an inspector. That inspector is not available on August 10th. So I'm trying to find somebody else to do the inspections. It's going to be either August 10th or August 3rd. We have a meeting coming up next week, so more to come, but I will, we are starting to do the planning. So if any of you want to be part of our wheelchair wash committee, it's probably 4 meetings, about a half hour each. I mean, we've got it down. We know what we're doing and how to pull it together. But it's likely going to be August 10th, and if not, then August 3rd. So I'll keep you posted.
Okay, great. Committee member updates. I don't have anything, Jan.
Just information passing, I guess, more than anything. I did have a visit with the manager of the Highlands at Winnebago, and she's in charge of, or the property manager, if you will, of both the Winnebago Highlands and the Neenah Highlands. So she has a pretty big job. Obviously, the Neenah one is quite a bit larger than the Winnebago one. So the Winnebago itself was built in 2013, and the owner, whoever built it, entered into an agreement or a contract, I'm not sure which, with the village of Winnebago to also create a senior citizen center within that complex. And in trade-off for TIF district monies. So this could be built. So Winneconne itself, as I understand it, is sort of stuck with making sure this thing keeps going. They are struggling a little bit. The attendance in the senior center part, she feels, is low. Could be a whole lot better. And only about 20% of we're all seniors, 20% of their own residents ever attend any of the events or programming that they have.
Umbro has the same problem,
Do they?
very low attendance.
They do have about 25 non-residents that attend, and you can do that by signing up and getting a key card, and then that senior center, which is locked, it's a locked building, is available to folks outside. And she wasn't sure how many of those people actually participate of those 25. But the numbers are pretty low and could be built up a whole lot more. The only thing she has talked with the Winneconne News and trying to get their programming posted, but they only post it once a month. And so she feels like that could be increased. I did share with her quite a few ADRC flyers that I've gotten through here. Falls Prevention Program, Live Your Life Well, the Virtual Dementia Tour. And she was going to turn around and post them there. They do have Joanne Spicer Murphy coming every Tuesday and Thursday for the Strong Bones program. And she said that is one thing that is fairly well attended.
You know, I appreciate you sharing that with her so that they can post it. But if they have specific events that they want to put in our newsletter, we can do the same for them.
Oh, okay. Okay.
Just all she would have to do is email the ADRC with the information, and we'll get it to the right person to get in our newsletter.
Okay, yeah, that may help if the Winneconne community, and it's not just the village, the greater community gets those kinds of things and looks at them. And then I had asked her what can we as a ADRC do to help you with the senior center or the retired population of the village. And she said that she was very interested in the falls. She said a speaker on the falls, followed by a risk assessment of any of the residents that are a part of that community if they agree to it. Also a speaker to come in and talk about Lifeline. They have issues with falling. Many of their people fall, and they're strongly encouraged to sign on with Lifeline or one of those type of programs to get help, but many of them haven't. They're just that resistance and no, I'm okay type mentality, and perhaps money, because this is independent senior housing. There is no assisted living portion to it. But yeah, she saw that. The other thing she thought that kind of from a nursing standpoint, and this would be perhaps the public health department somehow getting involved, a monthly health chat about a variety of subjects, followed by a blood pressure check. They used to have the Valley DNA coming in, and that's gone away. I don't know if it went away with COVID and never came back. But she could see bringing that as an opportunity for their residents to at least do an on-premises health check.
Yeah, maybe we could do like an afternoon where we explain about power of attorney and some ADRC things, Lifeline, see if public health could come and do blood pressures.
Trusted person.
Yeah, because we talked to the Amro one that's going to be opening up about having an event like that, so we could do the same.
Okay.
Do they have set hours for their senior center?
Yes. Well, she had said those people that have the key card, it's available to them between the hours of 8 and 5. And they can't come in there at night and all that kind of stuff because they do try to keep their residents safe. Their programming is sort of all over the page. I've got a calendar of some of their programming, and I suppose you could certainly look at that. Looks like most of it is other than the Strong Bodies program is geared towards entertainment. Weed bowling, sheephead, crafting, cribbage, all that kind of stuff. So she doesn't organize any of that. That's maybe a group-led thing. Thank you.
Harold, do you have anything?
No, I have no update.
Rob?
I don't have anything.
Nope, I don't have anything.
Yes. It was because of Jim at the last meeting. I thought, wow, he's contributing to this by going with the Committee on Aging up in Neenah, I believe it was. I thought, oh my God, I'm a retired and I worked in the unions for years. I'm in good standing in AFL-CIO, steel workers, the whole bit. I can go to any of those meetings as long as I get hold of the international rep. So I talked with Beth to give me some of the literature and I would present it. And I just did it this last Saturday. I'm trying to get hold of Bob Links, and that's with the Oshkosh Truck Union. At any rate, it went fairly well. Then I realized something, that I wasn't as educated in this as I should have been. But the aging and disability kind of gives everybody a thought of, what do I care? I'm not old, but they're gonna get there.
Yeah.
But also, when we talked about the phones, that's a government program. So should we be explaining that to people that want to come to the ADRC, incorporate that? If it is, that makes it more exciting when you talk to people. When they hear they're gonna get some phone service for $9 a month, they're gonna listen to you. I guarantee you. So that was one of the questions I had. Can I incorporate things such as urban housing? They give out loans. Those loans are federally sponsored. So, and old people and disability, we're all entitled to that. You know where I'm going with this?
I do, and there's people
Okay.
that fall into both categories and still don't consider themselves aging or disabled, but that's common.
Right.
But, you know, we've done other things too, where we will advertise and sometimes even give out a certificate for a free memory screen. Well, they're free anyway, but you know, it's like, come there and you get a free memory screen, you know, and people, obviously food draws people in, but there is some key things, you know, saying, you know, reduced phone service, free memory screen, that does attract people's interest, for sure.
Well, at any rate, what they're gonna do with those pamphlets, they're gonna put them on all the bulletin boards, the union bulletin boards with the phone numbers. I don't know if that'll help out or not,
Thank you.
but I'm gonna keep this up for a couple of months, because I cannot say I'm coming to your union meeting, because most of them are on Saturdays in the morning. So you gotta make your choice. So that's my contribution.
Appreciate
Very
it.
nice.
The cool thing there is they might not be elderly, but they may have parents that are alive.
Yeah,
There's
that's
friends
right.
that-
Or her
Right.
uncle.
Yeah.
It's the whole, yep.
And I'm just the opposite. I don't like being reminded that I'm the elderly.
Happens to the best of them.
Yeah, I missed your speech.
What are you talking about? What about that old lady over there?
That was a good group.
Who do
It's
you
kind
have
of funny
anything?
because, you know,
No.
it says I'm probably older than her.
Let's see what they wrote on their
Jim,
thing.
I have three things, and I'll be brief. First one is I talked to the Fox Crossing. They do not have a committee on aging. Any activities that they do is done through the Park and Rec. And they do a fair amount of activities. I also met with Carol Casimir at the city of Neenah. And I'm going to ask Beth to add her to the mailing list. And then I attended the Menasha Committee on Aging meeting. And Christine has a very robust group there. The senior center and all the activities that they're working on was very impressive. And I don't know, you could maybe be a speaker here sometime and talk about the things that you're doing up there. It's very
That would
impressive.
be great.
Christine, is there anything you'd like to share today?
I didn't really come prepared to share anything, just listen in, but, it's very helpful for me to sit in this meeting, as I now know, because of hearing of all the things that are going on, that there's quite a few things that I didn't realize, is happening. Some things that are happening in my neck of the woods too, so, that was really helpful for me. I appreciate you allowing me to be here and listen in, and Jim coming to our meetings, and hopefully, maybe not every meeting, you know, but here and there, I think it would be really helpful for information sharing and connecting the folks that utilize our services. You know, we're focused on Menasha specifically, but connecting them with some other county resources.
The agenda is posted on the county website about a week in advance of the meeting. So if you ever want to just take a look at it and see if there's anything on the agenda that is of particular interest, as well as you can call in like Liz did too. So.
Oh, yes, that's awesome. Thank you.
And you're gonna continue to keep Christina on the mailing?
I added her to the.
Okay, good. I saw that.
And if it's posted publicly, I can reach out.
I'll send it to you.
Brooke, do you have anything to share? No. How about you, Liz? You have anything more today?
You promised not to talk anymore.
That's what she
Living up to her promise.
That's too funny.
Okay, and somehow I missed the other departments, so we'll put it under the community beat. Do you have anything else today, Beth?
No, I didn't.
How about Brian? You have the updates for us,
I
Brian?
just usually give you guys numbers, and to Beth's point about the busyness, we had 61 enrollments to Family Care and Iris last month. That is humming along really, really crazily. We had 79 folks, unduplicated folks, had a functional screen, which is the physical eligibility piece of those. That compares to the month prior, we had 43 enrollments, so we're up about 18 if my Winnebago math works, from last month. And then year to date, back in January of 23, we only had 40 enrollments, so we're humming along really well as an ADRC. So kudos to our staff that is busy. It's actually somewhat supportive to hear that it's happening in other places too. It's not just us.
Yeah, counties with wait lists.
Yeah, we're not 3 months behind, but I will say we have our little, it's not a wait list, but de facto, our staff is so busy that when they're doing these functional screens, they're scheduling out sometimes 2 to 3 weeks to be able to get someone, just because that's how many numbers we're doing. So it's busy in our neighborhood.
Can I ask a question?
Yes.
Just related to that, do you have a sense of why those numbers have really picked up?
I just need, and one of the things that my staff is kind of always bringing is that, you know, I know people don't necessarily know us, who we are, but more people are coming to us saying from another referent, like maybe a discharge planner, more people are coming to our ADRC saying, my mom needs a functional screen done. You know, not starting with, I need some help in the home, but already knowing, feels like we're getting people later in the game. People are caregiving for their loved one at home as long as they can, and then just can't do it maybe anymore, and or have an incident where they're hospitalized or something like that. But we're seeing more people asking for functional screens almost immediately when they call, versus just the other things, you know, kind of the Beth's point about helping out with being able to buy our own caregiver into the home and stuff like that. We don't see that quite as much.
There was a demographer that was part of this discussion earlier today too, and he shared some numbers, and the jump, I think it was 2020 to 2021, if I remember right. I can't remember the year. I can share the PowerPoint with you, but huge jump in our aging population. So the demographics too are also support our busyness.
What exactly is involved in the functional screen?
It's actually the state's web-based tool that assesses the physical eligibility for these long-term care programs, Family Care and Iris. And it goes through what we term activities of daily living, which are bathing, dressing, eating, and then what are called instrumental activities of daily living, taking your medications, meal preparation, all those things that we all do on a daily basis, probably take for granted a little bit. And then the tool basically assesses what deficiencies you have in those areas, and then what help from another human being do you need to have that. Whether that's, you know, supportive home care coming into the house, or it's, I can't live on my own anymore, and I need to be in a place where someone anticipates my needs 24/7.
Yeah, sometimes people say, well, is a diabetic eligible, or is someone with epilepsy eligible? Well, it depends. You could have a diabetic who's pretty well functioning, if you want to call that with me, or you could have one who's got amputee and not able to take care of themselves. as well as visually impaired or blind. You can have a person with epilepsy who works and drives and knows they have an aura when before they have a seizure and they're petit mal seizures and they're fine. And then you could have a person with epilepsy who has significant grand mal seizures and brain damage from it, you know. So the diagnosis or the disability is part of it, but it doesn't by any means determine how well a person functions. That's why it's called a functional screen.
Someone told me at check-in last week that it takes at least a couple hours for every functional screen you're doing. It's going to take you at least a couple hours to get that. A lot of our staff prefer to be unbothered when they're doing that stuff because they take a lot of pride in putting in their comment sections who that person is, explaining the why. So that is a huge, I don't want to call on Corinna, but maybe Corinna could, that's really her reality. It's a great deal of what our staff does. Lisa
Yeah,
used
you
to
have
do
to
it.
gather all the medical diagnosis from the doctor, and sometimes that can take a long time. You have to make multiple contacts to get the information. You have to link up, you're communicating sometimes with people who aren't really able to explain always like what's going on. You have to kind of observe in the home when you're meeting with them and assessing them. How are you getting in and out of the tub? It's really very thorough because it's a state tool and you have to document everything very detailed and tie every need to a condition, a medical condition or a cognitive condition. So it can take a couple hours just to actually sit in the home with someone, and then you can have 4 more hours of putting it all in the computer and getting the diagnosis. I used to do a lot of those, so.
Not consecutive hours.
Right.
Because you're waiting for
You're waiting,
callbacks.
right, exactly. You don't
So
always
it's
have
adjusting the rest of your calendar to kind of accommodate that. So it's.
And then for
I don't-
those who aren't receiving Medicaid, you have to help make sure that they are receiving Medicaid. You can't roll in family care unless you have Medicaid. So there's financial and functional eligibility. Yeah.
Very
It's
thankful
a lot.
that we have the crew we do. They are amazing. I don't even know how they do it sometimes, but they do it.
Wonderful. Anything else?
Thank you.
Lori?
Not anything overly. I mean, we participated in the Aspect Senior Center Health Fair, and there was a high needs, lots of questions on falls. And, the strength, interest in Tai Chi, looking at getting more people trained for Tai Chi is one of those things something that's going to be easy for people to come in and actually do. Strong Bodies was a real one that was there. There was a lot of people coming through. It was a well attended outfit. It was pretty cool to see. And just getting your name out. Elise was there. Is so that people get to know who you are. Because so many times people think, well, I'm not old, right? And no one is old, but we have to train people to know that everyone's aging, and how do we age as healthy as we possibly can. That's really what we need to do. So it's fun to get out. I love to get out and do those things and educate people so that they can stay as healthy as possible and know where they can go when they need a little bit of help. So many times people go from oh my gosh, they need to go somewhere when they really only need a couple things to be able to stay in their home. But financially, sometimes it's a barrier. So knowing what we can use is really important. So.
I like what you said about aging because, for someone says, well, Aging and Disability Resource Center, I'm not disabled or old. Are you aging? Because we are the aging. Everybody's aging.
Right.
So, nice.
Yeah.
Carol, did you have something that you were asking?
Yeah. Lori, what's the COVID situation in Winnebago?
So I connect with Jennifer because she does more of the communicable disease side just to see where we're going. And so all numbers are going down. So the flu, they're seeing a down tick on RSV, COVID, influenza, all those things. So they're starting to come down now.
Anybody else have anything?
Yeah, I got two.
Okay.
Getting back to the legislators. Two things you might consider is one, you and Brian get together. Is there something that you have to do in reporting to the state that you think you have a better way of doing it, or it should not be done, or it doesn't have to be done? That's one thing you might want to talk. The other thing I was wondering about, this is on the edge of being out though, is what about, as long as the legislators are coming here? Would it be right for us to contact some of the providers? And let them know they're coming in case they have a question, not that we
Yes.
ask them to come to the meeting. They
Yes.
may have something that they're really concerned about that we could pass on to the legislator. I don't know, something.
Yeah, I think maybe I'll format the room a little different, and have us at a table a little closer, and then have a couple rows of chairs, so people that wanna just come and listen in. And there are things that, you know, with this 100% time reporting, it takes a lot of time. So if I have to sit and record every 15 minutes what I did and how I spent that time, that takes away from time with the customers. If they just went back to random moment time study to recap the same dollars, it would create more time with customers. So yeah, there are things like that that Brian and I can talk about.
I was just gonna say, cool observation. I think it's really neat that you committee members have taken something and are researching it and bringing it back to the group here. That's really a neat thing. Just an observation. Educating us.
Well, if nobody has anything else, entertain a motion to adjourn.
I'll make a motion.
Second, anybody? All those in favor? Take care, everybody.
All right.
Yeah, yeah.